Hi YouTube, it is your girl Shelly Speaks, and I am coming on here to give you guys an update on my thyroid situation. So I went to the doctor today, and the good news is my thyroid nodule is benign from the sample that they took. She did say that sometimes when they take samples, because they focus in one spot, that there could be cancer in another spot of it, but you know, you don't really know until you get in there. Also, as I told you guys before, I was going to ask her, and I did ask her about, got a scar right here on my nose, I don't know what happened. But anyway, I asked her about the external laryngeal nerve and if she could protect it. And so she said that basically when she puts you to sleep, she monitors a couple of different nerves to make sure that your voice stays the same. She was actually very confident in her ability to do the surgery and to keep my voice intact. She understood that I was a singer. She also stuck this tube camera, well not tube, she stuck basically a tube down my nose with the camera on it so that she could take pictures of my voice box, so that she could see the condition of my voice box, what it looked like, so that she would know for once, you know, she got inside to make sure that everything still looked the same after the procedure was over with. So I actually feel pretty good about having her do it. I did also tell her that I did find the doctor at Johns Hopkins, and she was just like, yeah, I mean, she was like, I can do it. She was like, I do thyroid surgeries all the time. She was like, now, of course, you know, you are entitled to get a second opinion or have somebody else look. She was like, if you just really want to go to Baltimore, you can go to Baltimore. But I do these operations, you know, 2 days out of the week. You're in good hands. You'll be fine. She was like, I treat all of my patients like singers because nobody wants to lose their voice, whether it's a singing voice or a talking voice. Nobody really wants to sound different. So her goal is to protect your voice. She said that she wants to just take out the right thyroid because of the nodule. She said the left thyroid was perfectly fine and in good condition. Also, if they leave in the left thyroid, my thyroid levels should stay normal. But in my opinion, I feel like my thyroid is low. It was a 1. And I think it's technically normal, but it's not in what they would call optimal level. From what I was Googling, optimal level is like 1.8 to 3.5, and my thyroid level is not there. I've always felt like it's been low, and I've had my thyroid tested now, I know, for a good 8 years. And it always tests low, but to me it always tests low, but they always say it's normal. So yeah, that is basically what is going on. I don't want to keep y'all real long. The scheduler for the operation is going to contact me so we can get the surgery scheduled. She does surgeries on Mondays and Thursdays. And the good thing is, she said I will only have to be off work for 1 week, which is great because I have a desk job. She said, now if you did something physical, then yeah, you'd need to be off for 2. But because you're at a desk, you can go back to work in a week, which is great because I had some plans for my birthday that I was like, I'm not going to be able to do it because I'm about to burn through all this time. And I'm going to need to have money put up to be able to cover me for a couple of weeks. And so that's good because I actually have enough sick time. I will have to have a doctor's note because I think anytime you use more than 3 sick days consecutively, you have to have a doctor's note explaining why you need to use these sick days. I'll have to get something from her in writing. I'll check with HR and the timekeepers to see exactly what they need from the doctor so that I can have that in before I go. I also let her know what hospital I wanted to go to. She gave me a choice of 3 different hospitals. So I did pick out the hospital location that I want to have the procedure at. And let me see. That's really it, y'all. So yeah, my biopsy was benign as far as what she could see. She's gonna just take out the right nodule, the right thyroid. She took pictures of my voice box and my vocal cords with the camera to make sure that everything stays intact and in place like it's supposed to. And of course she said, you know, with any operation, there's always a chance that it could be messed up or something, she said, but typically everybody comes out fine and their voices all stay intact. She was like, you know, I don't want to mess anybody's voice up. So we shall see. I'll be glad to not have the sore throat and scratchiness from talking. If you hear noise in the background, I'm sorry, my kid is 9 and he sings all the time. I wonder where he gets that from. So anyway, thank you guys so much for watching. Bye.